everyone, good day. By the way, I am Darrell Emmanuel Vichua, student nurse of Section B. Did you know that a lot of diseases arise due to lack of time of people to do personal hygiene? Almost all of the bacterial or viral infection develop because people tend to disregard the importance of doing it. Therefore, let us always instill in our minds and in our hearts the importance of doing personal hygiene. And in this video, I'll be showing to you how to do mouth care for or to conscious patient. But first, what is the meaning or definition of mouth care? Basically, mouth care is defined as a scientific care given to the mouth as well as to the teeth of the patient, wherein it aims to prevent the spread of diseases. Thus, it provides comfort and promotion of health to the patient. So what are the rationale or objectives why we perform such activity, which is the mouth care? So first is that it maintains a healthy state of mouth as well as to the gums, teeth, and lips of the patient. Second, it also removes any food particles that are present to the mouth of the patient from around and between the teeth of the patient as well. Third is that it also removes any dental plaques that are present to the teeth of the patient. Fourth is it also prevents sore and infection of the oral tissues of the patient. Fifth, it also prevents mucous membrane from drying out or from drying. Sixth is it also stimulates appetite of the patient. Seventh is that it relieves discomfort resulting from halitosis. And last but not the least, which is the eighth one, is that it enhances the client's feeling of well-being. And I believe those are the important things why we consider doing mouth care for our patient as well as to ourselves. And the next video or the next clip that I'll be showing to you is that what are the important articles or equipments in order for us to do the activity, which is doing mouth care to our patient. Okay? Right now, I'll be showing to you what are the needed articles or materials or equipments in order for us to perform such activity, which is doing mouth care for conscious patient. Okay? So first, this is very important. We need to have a toothbrush. Basically, this toothbrush is from our client or from our patient. This is very important because without this, we cannot perform this activity, as well as with toothpaste or powder, but I'm using a toothpaste. We also need to have a cup of water. This is very important for rinsing, as well as a dental floss. We will be asking the patient if whether the patient wants to be flossed. So we need to have a dental floss. Of course, we need to have an emesis basin. However, since I don't have an emesis basin, I just use this tub instead as an alternative from the emesis basin. We also need to have a mouthwash. Since I don't have a mouthwash, I just use this backfiddle instead as an alternative. It's also very important for us to have a paper waste receptacle because this is where we're gonna put our waste later while doing the activity. We also need to have a face towel so that if there are any, if we are to dry the mouth part of the patient, we'll be using this face towel. Of course, the very important one, gloves. We need to wear sterile gloves so that our patient will be safe as well, so that we cannot transfer any microorganism coming from me to my patient. Same as with the alcohol or 70% rubbing alcohol. We have here 70% rubbing alcohol. This is very important in order for us to disinfect our hands to remove any microorganisms that are present in our both hands. Of course, we need to have a pen and of course a paper in order for us to document the activity after we do such activity, which is doing mouth care. And now let's proceed to the proper procedure. The first step that we will be doing in doing mouth care to our patient, which is a conscious patient, what we're going to do is we need to identify the order or the activity order. We need to identify whether our physician ordered for us to do such mouth care for our patient, since I've already watched the order a while ago, or order sheet. It says there that we're gonna be doing a mouth care to our patient. And the next step that we will be doing is we need to assess patient's capability to assist with oral care. Okay, sir? Can you please open your mouth, sir? Close it again. Open it again. Close. Okay, very good. Thank you so much for that. So as you can see, our patient was able to open and as well as close his mouth, so which is good. It shows that our patient is capable of doing such activity, which is oral care. And the next step is we need to determine whether the patient has dentures, bridge words or partial plates present to our patient. Okay, sir, can you please open your mouth in order for me to check if you have dentures or bridge words? Okay, close it again, sir. Thank you so much for that. As I check, our patient doesn't have any dentures or any bridge words that are present in the mouth of our patient. So that is good. And the next step we'll be doing is we need to assess the patient's general oral health. So basically that includes the gag reflex, as well as to the condition of the teeth of the patient, as well as the gum, the mucous membranes of our patient. So again, you need to ask permission from your patient to open his mouth in order for you to identify and to check the condition of the mouth of your patient. Again, sir, can you please open your mouth? Gag reflex. Okay. Mucous membrane is great. Okay, then you can now close it up, sir. Thank you so much for that. So as I check, our patient doesn't have any condition that may hinder us to perform such activity, as well as our patient doesn't have any dentures, which is good. As well as the gum of our patient is in a good state, as well as to the the mucous membrane of our patient. The next step that we'll be doing is we need to assess the patient's usual or I'm sorry for that, oral care that includes the culture of our patient, because maybe the way of oral care is different from their culture, from the culture that we are to perform to our patient. So that's very important. You need to ask from your patient. So again, sir, usual ka na imong pagpa-toothbrusher, usual na siya or na kailangan ibuhat? Parehara? Usual ra? Parehara. So meaning our patient toothbrush or brush his teeth normally or in a normal kuan. So naakay kuan, sir, kanang mga sa imong culture, sir, basig na ay kuan dito na dili ta pwede mag-perform ani na or wala? Wala. So that is great. So our patient doesn't have any cultural barriers that will hinder us to perform such activity. And the next step that we'll be doing is we need to determine assistance. If our patient needs assistance or need assistance in doing such activity. So sir, kailangan ka na magpa-assist or kailangan pag-assistance para sa imong healthcare karon? Kailangan. So our patient said he needs assistance in doing mouth care. So I'll be here, sir, to assist you in doing mouth care. That's not a problem. As well, what we're going to do next is we need to obtain the needed supplies or the needed articles in order for us to determine or to perform such activity. Like what I've already shown to you a while ago, we have here our toothbrush, our toothpaste, our moisturizer in order for us to moisturize the lips of our patient, as well as the floss, a cup of water, nemesis basin, as well as a mouthwash, gloves, alcohol, pen, a face towel, a paper-waste receptacle, and as well as a towel. This will serve as a receptacle, or it will serve as a shield in order for us not to get wet the upper extremities of our patients, as well as to the linens or clothing of them. Okay. Since our equipments are already present, are already visible, and is already present here, what we're going to do next is we need to wash our hands. So in this video, I'll be showing to you how to do proper hand washing. Now let's proceed to the next procedure, which is we need to identify the patient. Basically, we need to identify the patient because maybe the patient that we'll be doing is not the patient that is actually being ordered from our physician, because maybe there are circumstances that the patient has the same surname of the patient coming from this different groups. So we really need to check identify the patient. Okay, sir, can I see your wrist? Because basically, let's just assume that there's a name in the wrist of our patient, because that is normal in the hospital. Okay, our patient is actually the patient that is needed for us to perform such activity, which is multiple, that is being ordered from our patient, which is Alfredo R. Velocis. Okay, the next step that we will be doing is we need to explain the procedure to the patient and assess the ability of the patient and what is the hygiene preferences of the patient, as well as what are the limitations in terms of physical activity to our patient. Okay, sir. Okay, sir. I am Darrell Emmanuel Vichua, and I'll be your nursing assistant for today. And may I know your name, please, just for verification purposes?
My name is Alfredo Bailoses.
Okay, thank you so much for that, Mr. Alfredo Veloces. By the way, just to give you a heads up, what we're going to do today is mouth care. Basically, mouth care is defined as a scientific care given to the patient in terms to the mouth and the teeth of the patient, because it promotes or it aims to prevent the spread of diseases. Thus, it promotes comfort and promotion of health to your overall or holistic care. And also, the importance of mouth care is that it maintains your healthy state of your mouth as well as with your gums, teeth, to your lips. Also, it also removes any food particles that are present to your mouth, around and between your teeth. It also removes dental plaques that are present to your teeth. Also, it prevents sore and infection to your or into your oral tissues. It also prevents mucous membrane from drying out. Mucus that are found into your mouth, it also prevents that. It's good. It also stimulates appetite. Sir, that is very important because by that, makaagdagdagan. Second to the last is it also relieves discomfort from halitosis. It's very important, resulting from halitosis. And last but not the least, it enhances your feeling of well-being. That is very good, sir. So, do you have any questions or clarifications before we proceed to the next procedure? Na kay mga pangutana, sir? Or wala ba? Okay, very good. Thank you so much for that, sir. And also, what we're going to do right now is we need to check the limitation when it comes to physical activity of our patient. So, yeah. Sir, kaya rin mo na mag-open sa atong mouth o mag-close? Kaya rin, sir? Okay, that is very good. So, our patient is capable in doing such activity. So, what we're going to do next is we need to provide patients privacy. Meaning, we're going to close all of the windows and curtains. Windows with the curtains as well as to the door. If we're in the ward, we need to close all the screens just to provide comfort to our patient. Okay, sir, I'm just going to close the windows for us to have a privacy while doing the activity. Okay. Since we've already provided privacy for our patient while doing the activity, what we're going to do next is we need to raise the bed at a comfortable working height. So let's just assume that our bed is already adjusted at a comfortable height. So that is good. And the next step is we need to lower the side railings or rail of the bed of our patient. So let's just assume that there's a railing and it already lowered the rail of the bed of our patient. And also we need to position our patient in a way that he is comfortable. Sir, are you comfortable with your position? Yes or no? Yes? Yes. So our patient is comfortable with his position. And now let's proceed to the next step. What we're going to do next is we need to position our patient or our client in a high faller or in a chair. Since no need for us to do that, what we're going to do is we need to elevate our patient in a way that he will be comfortable while doing the activity. Okay, sir, I will be elevating you so that you will be comfortable while doing the activity. Okay, sir, can you please move upwards a bit? I will get another one, sir, below. I'll be back. Very good. What we're going to do next is we need to why we do this is in order for us to prevent aspiration of our patient, and it also we need to do self-care for our patients. So basically, we need to arrange the supplies with the patient's reach. So we need to arrange in a way that our patient can able to reach the needed materials or the needed articles while doing the activity, as well as we need to assess the patient on a side with the brushing or flossing as needed. So we also need to administer our patient while brushing and of course flossing. And we need to place a towel across the patient's chest. Okay, I'll be getting our towel. Okay, sir, I will just put this towel to your neck so that this will protect you from any spills maker. Okay, what we're going to do next is we need to don disposable gloves. Basically, this is very important because in order for us to wear gloves or to clean gloves, we really need to wear this in order for us to protect ourselves as well as the patient, most especially when it involves touching the body fluids of your patient. And yes, that is very important, or that is the reason why we really need to wear gloves. And in this video, I'll be showing to you how to properly wear gloves. Since we already wear our gloves, our pair of gloves, what we're going to do next is we need to moisten toothbrush and we need to apply a small amount of toothpaste, and basically you need to remember to use a soft bristle of toothbrush. So yeah, we need to moisten our toothbrush. Wet it a little bit. Okay, very good. And apply a small amount of toothpaste to our toothbrush. And the next step that we will be doing, we will be placing an emesis basin under the chin, and we need to brush the teeth of our patient holding the bristles at a 45-degree angle to the gum line. And also, using a short circular motion that is very important in a gentle way. You need to include the inner and the outer surfaces of the teeth of your patient, as well as to the gum and to the crown of each tooth. And you also need to brush the biting surfaces of the back of the teeth, holding the brush bristles straight up and down to the teeth, and brush back and forth like that. And you also need to allow patient to rinse his or her mouth and expectorate into MSs. So gently brush the patient's tongue afterwards. So we need to brush our teeth. Okay, sir, can you please open your mouth? At the 45-degree angle, doing a circular motion to the teeth of our patient. Can you please open your mouth? Back and forth to the biting area of our patient. Make sure to do it in a way that it is not irritating or uncomfortable to the patient's situation. Okay, sir? Open your mouth. Do it gently. Do it gently. Close your mouth. Like that. Smile. Okay. Do circular motion in a 45-degree angle to the gum line of other patient. Brush it thoroughly. And sir, can you please your tongue inuwi like pagawas? Pagawas. Brush the tongue of your patient gently. Okay, sir, that's okay. Smile, smile, smile. Like that. Okay. After that, what we're going to do is we need to expectorate or give a patient a water and then rinse. Bitter. Rinse water. Remove motor. Expectorate. Okay. Rinser. Remove motor. Again. Move. Again. Move. Okay, very good. Are you already sir? Comfortable? Wala na yung mga kuan? Okay na. So our patient was able to remove all of the toothpaste from his mouth, which is good. And what we're going to do next is set aside your messy basin as well as your cup of water. And get your face towel or face cloth, and then gently clean it. And then what we're going to do next is we need to floss the teeth of our patient. Basically, how to do it, we need to wrap one end of our floss around the middle finger of each hand. So middle finger, dua, this two. And stretch the floss between your thumb. So stretch it using your thumb, the tool tip, like that, and index fingers, and move the floss up and down against each other or against each tooth, and floss between and around the teeth. So afterwards, you need to assess the patient in rinsing the mouth or ask the patient to rinse vigorously or spit the water into the basin. So I actually rinse the mouth of our patient immediately because I can see that our patient is uncomfortable if there are any toothpaste present into his mouth. So after or before I floss it, I just make sure that our patient was able to rinse his mouth clearly so that it would be comfortable for him to be put or to be done flossing, because there will be no toothpaste present to his mouth as well as to the teeth of our patient. So yeah, we need to get a floss from our floss here and wrap around into the middle finger of the two middle finger. And after that, what we're going to do next is use your thumb in order for you to floss, and make sure to up and down. Okay? That is the proper way of doing floss. Okay, sir, can you please open your mouth? Open up. Make sure, guys, that you will include the in-betweens of the teeth of your patient as well as the teeth around. Okay. Make sure that you're able to floss it well. Open your mouth, big sir, like that. Very good. Up and down. Open it, sir. Okay, I believe that I actually flossed our patient correctly. What we're going to do next is we need to distribute or throw our floss to the paper waste receptacle. Okay, what we're going to do next is we need to rinse the mouth of our patient. Okay, you need to get your utensils basin again. Sir, can you please open your mouth and drink and try to rinse. Move, sir, like that. Rinse it well. Again. Okay, rinse. Okay, very good. Our patient was able to rinse his mouth properly. And what we're going to do next is we need to assist the patient, since we've already rinsed rigorously and spit the water into the space. And what we're going to do next is we need to offer a mild or diluted mouthwash and a mouthwash to our patients. So sir, okay ra mo sir na magpa-mouthwash ka or dili sir? Okay ra? Dili ra ka magpa-mouthwash? Dili ra. So our patient doesn't like to be mouthwashed since I have a mouthwash. So what we're going to do is just skip this because our patient doesn't want to get mouthwash. You need to really ask permission from your patient that if the patient wants to be mouthwashed. That's very important. You need to ask from their permission. Since our patient doesn't want to get mouthwash, now let's proceed to the next step, which is we need to dry the lips of our patient with the use of towel. Okay, sir, I'm gonna dry your face. Okay, very good. What we're going to do next, after drying it, we need to apply a lip moisturizer if desired. So as I can see, our patient really needs any petroleum jelly or any moisturizers needed for his lip in order for it to be moisturized. Okay, sir, I will apply a moisturizer to your lip. Close it. Very good. We've already applied or properly applied moisturizer into the lip of our patient. What we're going to do next is we need to do aftercare. But before doing aftercare, you also need to assist the patient into a comfortable position because we've already done with our procedure. So make sure to assist your patient in a comfortable position. Okay, sir? I will just get this. And let's lay down properly. Let's move it. Like what we did. And you may now lay down. Okay, very good. What we're going to do next is we need to do the aftercare. Now, I'll be showing to you how to properly clean the toothbrush of your patient. Clean your imaging basin, as well as the covering of the toothbrush. Okay, we've already properly rinsed the toothbrush as well as the nasal space and our patient. What we're going to do next is we need to dry it. So here comes our paper towel. So we need to dry our toothbrush with a paper towel and then set it aside. And after that, throw the waste, which is this one, or our paper towel to the waste receptacle. Okay, after that, get another one and wipe the basin or in this basin. Okay, very good. And then throw it into the paper waste receptacle. And now let's go back to the patient. Okay, since we've already done cleaning our toothbrush as well as the nasal basin of our patient, what we're going to do next is we need to raise the side rail of the bed of our patient and lower the bed and provide quiet space. So let's assume that I've already raised the railing and provide safety and comfort to your patient. Okay, the next step is we need to perform hand washing. So we need to get rid of our gloves. Okay. And throw it to the paper waste receptacle. Okay, what we're going to do, since my hand doesn't have any heavy soiling, I will be using a 70% rubbing alcohol in order for me to disinfect my hands from any microorganisms that are present in my both hands. Okay, this is very important in order for you to avoid or to prevent cross-contaminations of bacteria to your patient. And after that, after doing hand washing, okay, make sure to really do it in a proper way. Okay, after that is that we need to evaluate our patient, meaning we need to inspect the teeth, the gums, and the mucous membrane of our patient for us to be able to identify and to verify that they are free from food particles or any bacteria or any dental plaques that are present in the teeth of our patient. So sir, again, can you please open your mouth? Open it wide. Okay, very good. Close it. That's very good. Okay, since as I checked the patient's mouth, I was able to verify that our patient was able to remove all the food particles that are present in the mouth of our patient, as well as the in-betweens of the teeth of our patient. So that is very good. And what we're going to do next is we need to inspect any abnormalities such as bleeding to the mouth of our patient. So again, sir, can you please open your mouth? Thank you so much for that. Ipagawas ang dila. That's very good. Close it. Since as I checked the mouth of our patient, there were no abnormalities like bleeding or any pain or any cuts that are present to the mouth of our patient, which is good. And the next step is we need to observe the patient's discomfort or gagging during procedure. So like what I've said a while ago, you really need to make sure while doing the activity, you need to make sure that our patient is comfortable in every procedure, in every step while doing the activity. That's why I'm constantly asking our patient that he is comfortable. Is he comfortable in this step, in this particular that? So that's very important. And the next step that we'll be doing is we need to document. So meaning we need to document everything that we've done to our patient, like the oral care was given, what's the patient's response, like that. So that's very important. So I will just get my pen and paper. I'll be back. I've already got my pen and paper. I'll be documenting it. Okay, oral care was given at 1 p.m. in June 20, 5, 2021. And the patient's response is that he is comfortable and doesn't have any complaint with regards to the activity that we've performed, which is mouth care. And there are no abnormalities or findings that are unusual while doing or after doing the activity for our patient. And the nursing intervention that we can give to our patient is to eat well, try to avoid food that may break or that may cause bad conditions to the teeth of our patient, like candies, any sweet foods, as well as to don't forget to brush the teeth of the patient regularly, as well as to floss it. So I believe that I've already shown to you the needed procedures, the needed steps in order for us to perform mouth care to conscious patient. So yeah, and that would be all. Thank you so much for watching, and I'll be showing to you this next clip how to do or how to perform mouth care to unconscious patients. Okay, thank you so much. Hi everyone, it's me again, Daryl Emmanuel Vichua. Since I've already said to you a while ago why personal hygiene is important, what I'll be showing to you right now is that how to do mouth care, which is one of the personal hygiene or one of the component of personal hygiene for unconscious patient. And now I'll be showing to you what are the needed equipments or articles in order for us to do such activity, which is doing mouth care for unconscious patient. Okay? Of course, that's what I said a while ago. This is very important. We need to have a toothbrush, basically coming from our patient, as well as a toothpaste. We also need to have a dental floss. This is also important in order for us to floss any the in-betweens of the teeth of our patient if necessary, or if the patient or it is not also indicated to the patient's condition, as well as a cup of water. Since I don't have an emesis basin, I just use this tub instead as an alternative. I also have here a padded tongue blade. This is also very important. Since I don't have a padded tongue blade, I just improvise. I just use this stick instead. Since I don't have a popsicle stick, I just use a stick that is not sharp, as well as I just wrap it with a sterile gauze. So yeah, need to be resourceful. Of course, we have here a moisturizer. This is also important, guys, because by this you're able to moisturize the lips of the patient, most especially if it is dry. However, if it is not necessary, no need for you to use such moisturizer for your patient. You also need to have a mouthwash. Basically, facial is very important, as well as the wearing of mask while doing such activity, because we cannot deny the fact that there are unintentional secretion coming from our patient. So in order for us to protect ourselves from those secretion, you need to wear a face shield as well as a mask. If you don't have, you also need to wear, or if you have a goggles, then use it. Of course, we need to have a paper waste receptacle. This is also important in order for us to store our waste with the use of this paper waste receptacle. And of course, a syringe. This is very important in order for us to rinse the mouth of the patient later as an alternative syringe. And I also have here a suction machine. Since I don't have a suction machine that is legit or that is true, I just use this as for return demonstration purposes. So basically, just to give you a heads up, suction machine is used in order for us to suck or to get rid all of that secretion of the mouth while we are doing such mouth care, while we are brushing, while we are rinsing. So you're going to suck those liquids coming from the mouth of your patient going to this machine. So this is the use of suction machine. I have here straight the device. And of course, we need to have a face towel. We also need to have a waterproof pad or towel. And of course, a sterile or clean gloves. And of course, we need to have an alcohol in order for us to disinfect ourselves and for us to avoid any cross-contamination of microorganisms between our patient and you, between the patient and you as well. But of course, we need to have a pen and a paper in order for us to document the activity later after we do such activity, which is doing mouth care for or to unconscious patients. And I believe those are the needed articles or equipment in order for us to do such activity. Now let's proceed to the proper procedure. Okay, now let's proceed to doing mouth care to patient that is unconscious. So basically what I've said a while ago, you really need to wear your face shield as well as your mask in performing this, because we really cannot deny the fact that there are unintentional reflex or any secretion from the mouth of our patient that may cause us or that may spill some liquids to our face because we're doing mouth care. So yeah, that's very important. You need to wear your mask, your face shield, or if you don't have face shield, you can also use a goggles instead as an alternative. And what we're going to do in this is we need to identify the ordered procedure. So we really need to identify the procedure or the ordered procedure coming from our physician before we proceed or before we do such activity. That's very important because maybe this patient it's not good for him to undergo mouth care. That is contraindicated into his condition. So that's very important. You really need to check the doctor's order. And yes, I've already checked the doctor's order a while ago, and the doctor agreed to do mouth care to our patient that is unconscious. I'm sorry for that, there's someone is calling me. And now let's proceed to the next step, which is we need to determine whether the patient has dentures, bridgework, or partial plates. Since our patient is unconscious, let's just open the mouth of our patient carefully and in a gentle way. Very good. So as I checked, the patient doesn't have any dentures or bridgework that are present in his mouth. For example, partial plates. That is good. So yeah. And the next step that we'll be doing is we need to assess the patient's general oral health, like what I said a while ago. That includes the presence of gag reflex, the condition of the teeth of the patient, the gums, the mucous membrane, and also if the patient has dentures. Okay. I will open the mouth of our patient, and we need to check that what's the condition the teeth of our patient. Okay, as I check, our patient doesn't have any gag reflex, any dentures as well, and of course, our patient doesn't have any, what do you call this one? The teeth of our patient is in a good condition, which is good, so we can perform the activity. So the next step that we'll be doing is we need to obtain the needed materials or the needed equipments or articles in order for us to properly perform such activity. And I've already shown to you a while ago what are the needed material. And now let's proceed to the proper procedure. We need to wash our hands, meaning we need to disinfect our hands with either washing it with soap and water, or you can do a 70% rubbing alcohol if there's no visible soiling found in your mouth, in your hands. So as I check, my hands doesn't have any visible soiling. What I will be doing is I'll be doing a 70% rubbing alcohol instead of washing it with soap and water. Okay, while doing the 70% rubbing alcohol, you also do it in a way the same with doing proper hand washing. Okay, since we've already properly disinfected our hands, what we're going to do is we need to identify the patient. Meaning we need to identify if the patient that we are going to perform is the patient that is being ordered from our physician or from our doctors, in order for us to prevent negligence through giving wrong procedure to other patients. Okay, I'll be checking what's the patient's name. Okay, the name of our patient is Alfredo Veloces. So what if I checked the order from our doctor? Yes, it matches. So that's great. The next step that we'll be doing is we need to explain the procedure to our patient. Even though that our patient is unconscious, we still need to explain the procedure to them, because we cannot deny, because there are some times that even though the patient is sleeping, they can still have that sense of hearing. Okay, sir, like what I've said a while ago, what we're going to do today is we will be doing mouth care. Mouth care is defined as the scientific care given to the mouth as well as to the teeth of the patient, and basically it aims to prevent the spread of diseases. Thus, it provides comfort and promotion of health to your body. And also, mouth care is very, very important because it maintains a healthy state of your mouth as well as to your teeth, to your gums, and to your lips. It also removes all of the food particles that are present to your mouth from around and between your teeth. Also, it removes any dental plaques that are present in your teeth. Also, it prevents sore or any infection present into your oral tissues. It also prevents mucous membrane from drying out by doing mouth care. That is good. It also enhances your well-being. So yeah, that's very important. So you also need to explain the procedure to your patient, what are the importance or the rationale where you perform this activity. Okay, the next step that we'll be doing is we need to provide patients privacy. Okay, you need to close all of the windows as well as to the doors. Since I've already properly set aside privacy from our patient, what we're going to do next is we need to raise the bed of our patient at a comfortable working height, and we need to lower the side rail of the bed of our patient, and we need to assess the patient in the sitting. Since our patient is not conscious, we just need to do it in a side-lying position with the head of our patient on the pillow. And we need to position the patient, like what I said a while ago, the side-lying position with the head turned to the side and the side with the head bent down. Okay. Let's just assume that this bed is already in a proper height, as well as we put the rail down, and we will side our patient. And don't forget, what we're going to do next is we need to set up suction or the suction machine and attach the suction tubing to the tonsil tip suction. So, yes, let's just assume that this is our suction machine and we've properly attached it already. Okay, we've already put already our suction machine. What we're going to do next is we need to place the waterproof towel, and then under that is we need to put the towel on the patient's cheek and chin. And also we need to place a mesh basin under the chin of our patient. Okay, we'll be putting some towel. In order for us to avoid any spills of water in our patient. Okay, very good. And the next step is we need to put a rubber. We need to put an anesthesia to the chin of our patient, and I'll be holding that later. And after that, you need to don mask. Wear your face shield or goggles and clean gloves. Okay, in this video, I'll be showing to you how to properly wear gloves. Okay, since we've already wear our mask, what you call this one, gloves properly, we need to always remember that we need to really wear a clean glove, especially when it involves touching the body fluids of our patient. So yeah, what we're going to do next is we need to moisten the toothbrush of our patient, and we need to apply a small amount of toothpaste. And basically, this is very important. You need to use a soft bristle of your toothbrush. And you need to brush the teeth holding the bristles at a 45 degrees angle like what I've said a while ago to the gum linen, and using a padded tongue blade, bite or block, hold the patient's mouth using that padded blade, bite blade. Using a short circular motion, gently brush the inner and the outer surfaces of the teeth of your patient from the gum line to the crown of each tooth, and brush the biting surfaces of your patient back and forth, and gently brush the patient's tongue. And after that, you need to draw about 10 milliliters of water washed into a syringe like what I've said a while ago. That's why a syringe is there. And you need to inject it in a gentle way into the mouth of our patient, allowing the fluid to drain into the VNS's basin, or you can use a suction as needed. Okay, moisten. You need to moisten the toothbrush of our patient. And you need to apply a small amount of toothpaste. And after that, you need to brush the teeth of your patient. Okay, with the use of this, tightly open the mouth of your patient and use our padded blade do it circular motion. Remember, guys, that's why it's very important for us to wear a face shield as well as a mask, because we really cannot deny the fact that there are unintentional releases of liquids to the mouth of our patient. And of course, you need to include the tongue of the patient. Do it in a gentle way. Apila ilahang pila ang toothbrush. Very good. Okay, very good. After that, set aside your toothbrush as well as this, and get a syringe and apply a 10 ml of water coming from your cup, and gently put or rinse the mouth of your patient. Okay, get another 10 ml of water as needed. And use your suction machine in order for it to suck all of the water dripping. Okay, make sure to really rinse it well. Do it as needed. That is why suction machine is very important, guys, so that all of the drains of water will automatically be suck from the suction machine. Okay, last one. Make sure to really, okay, very good. Set aside your syringe, and the next step is we need to properly or gently wipe or dry the mouth area of the patient. Okay, after that, what we're going to do next is we need to provide denture care if necessary, since it is not necessary because our patient doesn't have any dentures. Now let's proceed to the next step, which is clean the tissues in the oral cavity using the following. So we need to have a foam swabs or a moistened gauze square wrap around the tongue blades and use a clean swab for each area of the mouth. Use this to clean the gauze, a clean and sterile gauze. Do it in a proper way, in a way that our patient will be comfortable. Open the mouth. Okay, very good. And set this aside after using it, or you can throw it to your paper waste receptacle. And after that, you need to remove the basin and dry the patient's face, and of course the mouth. Okay, let's dry it again. It's very important. You can also use a floss or floss the patient. However, it is said there into the doctor's order that no need for you to do flossing to the patient of the patient because it is not necessary, as well as it is contraindicated into the patient's condition. So let's just skip the flossing, and we need to apply a water-soluble lip moisturizer to our patient's lip. Okay, apply a moisturizer. Very good. I properly apply the moisturizer. What we're going to do next is we need to do aftercare. Meaning we need to assess the patient in a comfortable position. We need to raise the bed rail and lower the bed and provide client safety. We need to remove the disposable gloves as well after, from inside to out, and discard it properly in order for us to prevent transfer of microorganisms, and after that perform hand washing. But first I'll be showing to you how to do aftercare. The faucet in a way that it will not splash, or the water will not splash into your clothes. Okay, and then set this aside and then clean your syringe. Very good, and set this aside. And of course, we need to clean our MSS basin. And after that, you need to set this aside. And of course, you need to dry it using a clean, dry paper towel. Okay, now let's proceed to the next procedure. Raise the rating of the bed, and then lower the bed in a comfortable position, as well as get rid of this. Then lay your patient back into its normal position. Okay. You need to make sure that it is comfortable to the patient. Okay, very good. After that, what we're going to do next is we need to disregard or get rid of this gloves properly, discard it appropriately to prevent transfer of microorganisms. Throw it into the paper waste receptacle, and instead of washing it or doing hand wash with the use of soap and water, what I'll be doing is 70% alcohol. I'll be using this one since I don't have a heavy swelling to my hands. Okay, since I've already properly disinfected my hands, what we're going to do next is we need to inspect the teeth, the gums, and the mucous membrane of our patient to verify that it is free from food particles, or in order for us to verify that it is properly clean. Okay, as I checked and as I verified the patient's mouth, as well as to the gums, the mucous membrane, the teeth, and yeah, the teeth of the patient are clean. There are no food particles that can be seen or visible to the mouth of our patient, which is good. And what we're going to do next is we need to inspect any abnormalities such as bleeding, inflammation, dehydration, or infection to the mouth of our patient, and observe patient's discomfort or gagging during the procedure. Okay. Okay, as I checked, there are no abnormalities present in the mouth of our patients. Therefore, there are no infections, there are no gagging, there are no alarms or no bad conditions that are present in the mouth of our patient, which is good. What we're going to do next is we need to document. We need to document all of the activities that we have just performed to our patient. Okay, let me get a paper as well as a pen. Okay. The oral care was given to Alfredo R. Bailoses at the time of 6 p.m. Date is June 29, 2021. And the oral care was given or was assisted with the nurse Daryl Manuel Vichua. And the patient's response, basically there's no response, so the patient's condition is okay. There are no abnormalities that are present or findings to our patient's mouth. There are no infections, there are no SARS, there's no fogging, so yeah. And the nursing intervention that I can offer is you need to check time to time the mouth of our patient. Okay, very good. I properly documented the procedure as well as to what we have done to the patient. Are there any abnormalities that are present in the mouth of our patient? So yeah, since I've already properly I've already explained to you every step of the checklist. That would be all. Thank you so much for watching, and I would like to thank my Lolo for thank you so much, Lolo, for participating. I hope you're doing fine despite that this is very constant. Thank you so much for the understanding of helping me in order for me to fulfill this return demonstration as well as to alter the demonstration, and as well as thank you so much guys for watching this video. I hope you're all doing fine, most especially that it's pandemic right now. You really need to take good care of yourself, do personal hygiene, and you need to protect your mental health. That's very important, as well as the holistic health. So thank you so much for watching. I hope you're all doing fine. God bless you and have a wonderful and blessed day ahead. Thank you so much.